Okay, so we have the agenda in the chat box. You're welcome to introduce yourselves as you enter in the chat box, but we'll also do it in person. I'm going to go ahead and spotlight myself so you know who's talking to you on this large screen, and then I will do that for our speakers as well. So welcome everybody to Health Ministries Network's Reconnect and Reopen Zoom meeting. We've taken a few weeks to develop this meeting, and the agenda has evolved over time based on your feedback in a little SurveyMonkey survey. And I'm just really glad that you took time to do this because it shows us what's really important to you. So before we begin, I'm Sarah Lane, and I would like to read on behalf of Health Ministries Network our land acknowledgement statement. Today, let us acknowledge the peoples of the Salish Sea, Nooksack, and Lummi people who have stewarded this land and lived here since time immemorial. As we share and live in this sacred place, let us breathe with a sense of gratitude and move in the spirit of unity, caring for all who thrive on this land and water, and to honor those who have come before us and who will come after us. And as we begin in this place, in this time, I want to thank you for being here. Faith community leaders, leaders in faith communities, nurses and health ministers, members of the medical community, trusted advisors, our Whatcom County Health Department, Whatcom Together, and Healthcare Coalition representatives. We are grateful for all the work that you've been doing during this very challenging year, even if we do not say it enough. Just to set the tone and the purpose of this meeting, which really is reconnecting and helping you or supporting you as you reconnect within your faith communities, I'd like to set the tone with a couple of bits of writing. The first is a quote by the inventor and TED speaker, Danny Hillis, who says, "A human body is a conversation going on, both within the cells and between the cells, and they're telling each other to grow and to die. When you're sick, something's gone wrong with that conversation." This year, we have seen, felt, and experienced many hard conversations in bodies around the world, but we have the opportunity to help that conversation go right in our own bodies, and we can put forth good information and work toward right relationships between the science and heart, and to invite health into our community. As we sit with that, we can also reflect on a spiritual text that many of us know well, the concept of in the Old Testament of shalom. I'll read a very short excerpt from our book for the Foundations course for Health Ministries Network called Health, Healing, and Wholeness by Mary Chase Zialik. The Hebrew term shalom is considered the concept most closely related to the term health in the Bible. Shalom is often translated as peace, but it means much more than that. It incorporates peace, prosperity, rest, safety, security, justice, happiness, health, welfare, and wholeness. In the Old Testament, shalom is used when there is harmony between people and between people and things. To be in harmony means to live in peace with someone or something. To be in good health, a person must live in harmony. In the case of a pandemic and our world, restoring harmony between cells, between bodies, within community, across nations, and around our world is our collective work. And so let us continue to find that shalom here. That is why we're here, to build this community and to talk, to share amongst ourselves and to learn and to grow. So what I'd like to do is to go around and introduce folks. I'm going to call on you and just let us know your name and where you're coming from, and maybe your faith community or where you're working. And then we'll do that very briefly, and then we'll go over the agenda and move along through that. So I'll start with Allison.
Sure.
Allison Williams.
I'm Allison Williams. I work for the Whatcom County Health Department in our Community Health Division. And most of my work primarily is with community partners in different tort site types of organizations. And it could be a faith community, it could be a social service agency. So I'm really glad to be here and looking forward to the conversation.
Thank you, Allison. Doug Bunnell.
Doug Bunnell, I'm a pastor at First Presbyterian Church of Bellingham.
Nice to meet you, Doug. Thank you for being here. Darren Klein.
Hi, good afternoon. My name is Darren Klein. I'm a supervisor at the Whatcom County Health Department. Glad to be here. Thanks for having me.
Thank you so much for being here, Darren, and thank you for all the work that you've been doing this year. Rachel Endicott.
I'm Rachel Endicott, and this is my second week as interim rector at St. Paul's up near Elizabeth Park in Bellingham.
Welcome, Rachel, and welcome to your new position. We're glad to have you. Ivan Montenegro.
Yes, my name is Ivan. I am a missionary pastor who is leading a church, a Hispanic network in Washington, in Oregon. And thank you for the invitation. I'm glad to be here.
Thank you for being here. It looks like you have got quite a vast area to cover. So thank you. I see Rachel. I don't know if you're able to talk. If you are, go ahead. And if not, we know that you're here. So this is Rachel Lucy from Peace Health, who is on the line with us listening, and she's happy to join. She's texting in. Okay, thank you, Rachel. Grace, and I'm not sure quite how to pronounce your name. Grace?
Yes.
Yes, welcome, Grace. Where are you coming from? Are you with a faith community?
Oh, yes, my name is Grace. I want you to see my face. My name is Grace. I'm serving here at Leiden United Methodist Church.
Wonderful, Grace. Thank you. Welcome.
Thank you so much.
Glad you're here. Janet Stephen or Stephan.
Stephan. Hi, my name is Janet Stephan, and I'm the parish council president at Faith Lutheran in Bellingham on McLeod.
Thank you and welcome. I'm glad you're here. Rob Volkamer.
Hi, I'm Rob Volkamer. I'm a member of St. Paul's Episcopal Church.
Thank you, Rob. Appreciate you being here. Liana.
I'm Liana Osterman at Sunlight Community Church, and I'm a faith community nurse.
Thank you, Liana. Liana is also on our board, and she's very, very knowledgeable, so thank you. I see Reverend Sandy, and I see part of your name. Can you introduce you? Oh, there you are, Weiscarver.
Hi, I'm Reverend Sandy Weiscarver, and I'm the pastor of Blaine United Church of Christ.
Welcome. And Bev. Oh, Bev, you're muted. Can you unmute?
Do you hear me now?
I can hear you now. Thank you.
Okay. I'm Beverly Bishop. I live in Linden, but I'm part of North Seattle Alliance Church, and that's in Bellingham. And I'm a retired nurse, but I've been with this group for about nearly 20 years. And I've enjoyed it very much, but I'm still in retirement and just kind of phasing out, but enjoy it very much.
Well, thank you for being here today, Bev. We appreciate your service. And I see Allison's iPad. I'm not sure of your name.
Hi, I'm Paul Bloom, using my wife's iPad. I'm a member of the Board of Directors of Congregation Beth Israel in Bellingham, and I'm the co-chair of the COVID Reopening Task Force at Congregation Beth Israel.
Wow, that is a very official name, and I really appreciate you being here. Thank you very much, Paul.
Thank you.
Yes, Carol Nicolay.
Carol Nicolay, I'm a health minister at First Congregational Church in Bellingham.
Welcome, Carol. It's good to see you. She is also our Foundations course instructor, and we're very grateful for her. And we have another Carol, Carol Shalokas.
Oh, very good. Carol Chalukas is how we say it. Yes. And I'm with the Blaine United Church of Christ, chairperson of the worship board.
Wonderful. Well, thank you so much. It's nice to see so many new faces. Ken, would you like to introduce yourself?
Hi, I'm Ken Bockenberg. I'm a retired chief medical officer at St. Joe's Hospital, retired anesthesiologist. I'm a member of St. Paul's Episcopal Church.
Thank you so much for making time to be with us today, Ken. I appreciate you bringing both your experience with St. Paul's and your experience in medicine with you today. Kathy Sellerite, would you like to introduce yourself if you're able? Kathy may just be listening today. She comes from Bellingham Covenant Church, and we're happy to have her here. Mary Lynn Palmer. Oh, Mary, you are muted. Oh, there you go.
Okay, I'm with First Presbyterian Church, and I'm a faith community nurse there.
Yes, thank you so much, Mary Lynn. I'm glad that you're here today.
Thank you.
Elizabeth Boyle.
Hi there, I'm Elizabeth, and I am working with the health department and the Port of Bellingham to support businesses and organizations like all of yours. I see many of your names where I've sent materials to you. I hope you receive our weekly newsletter, but we're here to support you in however we can in reopening safely and caring for your congregation. So thanks for letting me be here today.
Well, thank you for coming. We really appreciate all these folks here who are here to support each other. I see Assumption Parish. Kathy, would you like to introduce yourself?
Sure. Hi. Yeah, I'm Kathy Ernst. I'm the pastoral associate at Church of the Assumption.
Thank you for being here, Kathy. Appreciate it.
My pleasure.
Yes. Holly, welcome.
Good afternoon. My name is Holly Telfer, and I'm one of the faith community nurses at St. Paul's Episcopal Church in Bellingham. And thank you for arranging this presentation. I think it's very interesting.
Well, thank you for being here, Holly. I appreciate that. Pastor Janice Schofield.
Hi, I'm Jana Schofield, pastor at Christ Lutheran Church in Ferndale.
Welcome. It's good to see you. Julie McElroy.
Hi, Julie here, public health nurse at Whatcom County Health Department, focus on COVID response, surveillance, data team, and more recently with the vaccination center, the community vaccination center at BTC.
Thank you so much for being here, Julie, and for all the work you're doing. It's really, this year has been such a magnificent effort on everyone's part to try to stay safe and to try to restore connection. So thank you. Glenda. Oh, Glenda's muted.
I'm Glenda McLaughlin, and I'm a faith community nurse at First Presbyterian Church.
Thank you, Glenda. Appreciate you being here. Pam Collier.
Hi, I'm Pam Collier from Hope Lutheran Church in Linden, and this is Shirley Anderson, and she's on our church council, and we have opened, and so we're just kind of interested to know more about moving to the next step.
Okay, well, I'm glad you're here. Thank you. Hopefully we can give some good support and information on that. Ted Swinburne.
My name is Ted Swinburne. I'm pastor of Northside Community Church in Bellingham.
Nice to meet you, Ted. I've worked with your faith community nurse a bit and gotten
Yes.
to know you through her, so I'm glad you're here.
Thank you.
Becca Niemeyer.
Hi, Becca Niemeyer here, Associate Pastor at First Presbyterian Church.
Welcome. We've got a lot of First Pres here. Bethany, good to see you.
Hi, Bethany Flint I'm a member at First Baptist Church in downtown Bellingham.
Welcome, I'm glad you're here. Jennifer Moon.
Hi, I'm Jennifer Moon. I'm a communications specialist at the Whatcom County Health Department, and just looking forward to this afternoon's conversation.
Thank you for being here. We appreciate it. Pastor Jeff.
Hello, I'm Jeff Flint. I'm the pastor at First Baptist Church in downtown Bellingham.
Well, welcome. Glad you're here. Kevin.
Thanks for having me.
Yes.
Hi, my name is Kevin Mikett. I'm a member of the board at Health Ministries Network, and I'm here as an observer. I'm not a participant, I don't think, but you can tell.
Okay, well, you're welcome to participate as you see it appropriate. Reverend Bobby Vierta.
Hi, thank you, Sarah, and thank you for pulling us all together. This is impressive. I'm Bobby Vierta. I'm the pastor at United Church of Ferndale until June when I retire.
Oh, welcome. I'm glad you're here while you're here. This is wonderful. Laura Welker.
Hi, everyone. I'm Laura Welker, and I've been supporting and working with the Whatcom County Health Department in its COVID response, most recently vaccination efforts. And I just have to say, it is so nice to see so many faces on the Zoom screen. Not all meetings have this many faces, that people who turn on their cameras. So I'm enjoying that sense of connection.
I am too. Thank you very much, Laura, and we appreciate your work. Amy Hockenberry.
Yeah, hello, everyone. Good afternoon. Amy Hockenberry. I'm also a supervisor here at the Whatcom County Health Department and working on our vaccine planning team. It's great to see all of you.
Thank you very much, Amy. Thank you for your work. Don Koch.
Yes, thank you.
Oh, you went mute. There you are.
Okay. Yeah, Don Koch, I'm Chair of Council at Sunlight Community Church in Linden, and thank you for the invite.
Well, thank you for being here. It's good to see you.
Thank you.
Steve Ban, or Bon.
It's Ban, Steve Ban. Hi, I'm a retired pediatrician, and I'm on the board of Congregation Beth Israel, and I'm the other co-chair of the COVID-19 Reopening Task Force at Congregation Beth Israel. And it's wonderful to see all the folks that I haven't seen at Peace Health. Rachel, I wish you had your screen on. I haven't seen you in a long time, and you're near and dear to me. Thank you.
Well, thank you very much. It's good to see you today. Thank you for being here. I think we have Celeste's iPhone. Hello, Celeste. Thank you for joining us. You're muted.
Hi, I'm Celeste Hildy. I'm in a medical facility. That's why I've got a mask on right now.
Okay.
I am from the United Church in Ferndale. I'm a faith community nurse there.
Thank you for your service and for being here today, for making time. Phil Rushton.
Hi, my name is Phil. I'm the pastor at Bellingham Covenant Church.
And welcome. Good to see you today. Your faith community nurses are wonderful to work with. We appreciate that. Kristen Henderson.
Hi, I'm Chris Henderson, and I'm the Administrative Assistant and Care Ministry Director at Bellingham Covenant Church.
Thank you for being here. Wonderful. I see Pam Newland. And maybe Pam is just listening. Paul Ehrlich, and I know it's not Paul.
No, it's Mary. Sorry.
Ehrlich.
I'm from Union Church in Seattle, and I'm a faith community nurse.
Well, welcome. Welcome all the way from Seattle. And I see Kathy. Did you want to introduce yourself? We kind of missed you because you were not on the screen.
Yeah, my husband's doing a project, so I'm jumping up to help him. I'm
Okay.
Kathy Stellarite from Bellingham Covenant Church. I'm a health minister.
Okay, let me see if I can. I'm starting to lose people. I see Barty Kirshner. Did you want to introduce yourself? And Barty may just be listening as well. Okay, did I miss anybody? If so, please jump in because you are rearranging yourselves on my screen.
Okay, Sarah, if you can hear me, I'm Barty Kirshner from Bellingham Unitarian Fellowship, and I'm from their board of trustees. And thank you very much for organizing this.
Well, thank you very much for being here, Barty. We are grateful to have so many people in the room together today. And I appreciate you and you meeting each other today in this long list of welcome and introductions. Before we continue, I'd like to just give you a quick overview regarding our agenda. Welcome, we did, goals for today, reconnecting, taking a look at the landscape, learning a little bit more about your victories, challenges, what's happening, and where to go next. And we'll start with this discussion among faith community leaders. I invite our experts in the room on some of the issues that may come up to jump in and respond to those as they come up, because we don't want to lose that thread, but trying to keep it relatively short in our responses and following up with our Q&A at the end. After we talk with faith community leaders amongst ourselves and introduce some of our victories, challenges, and questions, what are we facing today? Then we'll talk a little bit about, we'll invite our Whatcom County Health Department representatives to talk about some tools for reopening, and then the role of vaccines in resuming community connection. We'll offer a resources list, and then at the end of this presentation, I'm going to leave this Zoom meeting open, and I'm going to stay on in case some of you want to continue to connect after the meeting, because it looks like we've got a lot of people and there may be some catching up to do or longer discussions to have, which is excellent. All right, so beginning with our discussion among faith community leaders, I just wanted to thank you for filling out the survey. The two big points that came out of our survey were, one, the biggest challenge we face is bringing diverse perspectives on health, safety, and vaccination together and managing really different perspectives. This is a time, this is a very difficult conversation to have and to hold science and compassion in the same space. And the second thing that we learned was that faith communities may wish to have a bit more support from the greater community and maybe from each other, and to remain connected more closely through this time of reopening. It looks like we're all in really different places, and this is a challenge when we look around among our faith communities. So I'd like to invite a few of you to begin to share where you're at and any challenges, victories, and what's next, and support you may need. That's a lot, but I'm sure there are some things bubbling up. I guess I'd like to start with Church of the Assumption representatives, because Kathy, I know that you put together a list from Father Moore and from your staff. And so can you give us a little overview of how things are going there?
Well, we've been very fortunate. We originally started with outdoor masses for about a month. And as soon as we were allowed to move indoors, we, worked closely with the Archdiocese of Seattle, with the health department and different areas to make sure that we were doing the things that would keep our people safe. And part of that is kind of funny because Father Moore was an engineer by training, and he was out there with a measuring stick, making sure that people would be sitting 6 feet apart. We instituted really strict guidelines. We had to register people for Mass. They were assigned seats. Hospitality ministers greeted them. There were signs, masks, hand sanitizers throughout the church. We blocked certain egress, in and out to make sure that we had traffic safely placed. And I would say the success was working with the science. Both Pastor Moore and Dr. Mabalot did a lot of research. Dr. Mabalot works with our musicians, and he was adamant that music is a place that spreads very easily the virus. So he's been pretty much our music ministry for this past year. And I think that was important. The big challenges for us, I should also say that we kept doors open, windows open. I mean, things that, enhanced circulation, even when it was cold. So people were encouraged to wear coats. Should I suggest challenges? Because I think the most difficult, and I think most of the pastors and parish staffs will understand this, has been dealing with funerals. Because not only were we limited in the ability to have people gather together for a certain time, but even now it's difficult because that is such an emotional point for people, and it's really difficult to monitor some of that for safety issues. Weddings have been a similar challenge, as have baptisms. I would just say that the most important thing I think is to know the science, stick with the science, be loving and compassionate. But if you know why you're doing something, you can explain it lovingly to people that disagree with you. I'm sorry, I can't hear you.
Sorry, that was me. Thank you. Pastor Janice Schofield asked, are you allowing singing with masks?
No, we're not doing any singing at all, except for Frederick. Right now, the word on singing is you'd have to be triple masked. And I wish he were here, but he's not feeling well today because of a COVID shot. But in certain cases, we have had, because we have great distance available in our church, we have had Frederick at the organ and a cantor, for example, at a mass for a funeral. But the distance has to be very, very large. And so no, we're not doing choirs yet. The choirs themselves got together and recently and had a conversation and just decided it's not worth the risk, even with the mitigations that could be put in place. So yeah, no.
Okay. Thank you so much for sharing, Kathy. If anyone has questions for Kathy and their experience in staying open pretty much through COVID, is that correct? You all have been serving in some capacity person to person throughout this.
Well, once the state allowed us to do that, okay. Yes.
Okay. Please.
I would like to offer one bit of information regarding the singing and the masks. This is Julie McElroy, public health nurse.
Oh, good.
And just to relay this updated guidance from March 23rd for the state of Washington. But for singing in choirs in the congregational setting, the 3-layered mask is also replaceable with a surgical mask. And the 6 feet distance is also in place with that, whether you're a soloist or not, or a wind instrument or a brass instrument. So surgical mask can replace the 3-layered mask.
Thank you.
Wonderful, Julie. Thank you. I see that Barty Kirchner is asking, what if your choir singers were vaccinated? Julie, you may be able to answer that.
I can. The protocol and recommendation is the same, vaccinated or not at this point. Pretty much across the board, whatever the parameters are.
Okay. Wear the surgical mask. Okay. Any other questions for Church of the Assumption or for Julie, maybe related to this?
I would like to drop in the chat box a link to this updated March 23rd faith-based reopening protocol that was just put into place. So it's really well laid out, but happy to take any questions.
Okay.
You mean April 23rd? You said it was March 23rd.
From my research and my notes, I wrote March 23rd, but Dr. Ban, I would trust your feedback if you have April.
Well, no, I just, like anyone else, listened to the news, and CDC came out with some mask changes just a couple of days ago. I thought that's what you were referring to.
No,
this is
this is a March 23rd date, particularly with updated protocol for religious or faith-based community reopening.
Yeah, this is Darren. This is Darren, Whatcom County Health Department. I work with all the businesses to interpret the governor's guidance and reopening. And Julie is correct. This guidance for religious and faith-based organizations was updated on March 23rd. We went to phase 3 in March 22nd. And now with the new information released by CDC, the State Department of Health is now working with the governors on how that's going to affect the current guidance. So in talking with my state contact this morning, they are currently reviewing that and seeing if there's going to be any updates that are needed.
Okay, thank you, Darren. And Julie did drop the link into our chat, so feel free to take a look at that. Carol Nicolay asked, are surgical masks N95? Darren is shaking his head to say no.
Well, I'll let Julie answer that as being the nurse, but go ahead, Julie.
Yeah, a surgical mask is not an N95. It's when you see someone walking around with that blue mask or a pink mask, that's typically what a surgical mask is. And they've fabricated the technology to have those 3 layers within that thin fabric. But it is titled a surgical mask. N95s are a whole other thing that I'm actually currently trying to educate myself more on the definition of, but they're different.
Okay.
I had a question, Julie. In terms of singing indoors, you mentioned wearing masks. It's, as someone who sings a fair amount in a synagogue, it's really hard to sing well with any kind of mask on. And so my co-chair has put in our regulations 15 feet distance. I'm not sure where he got that, but is that would that be sufficient distance to be singing without a mask if you're at least 15 feet away from everyone else?
That is not any structured approved guidance at this point. The particularities that I've seen as far as that distance and any theatrical performance is that for wind or brass instruments with a mask, they say stay 9 feet masked, but the recommendation is 12 feet. And I do know that whether indoor or outdoor as a singer within a group, choir, or a soloist, it is the masks and the 6 feet distance. However, they do have something in this document that I dropped here, the updated protocol, where it talks about someone speaking in front of a congregation, where if one person is speaking, they can take their mask off, but that's different than singing. So I guess it's how loud you sing if we want to get.
I'd like to jump in there again if I can. So under the current religious and faith-based guidance that we are talking about here, under live music and performances, a soloist singer can and is permitted to sing without a mask, provided they maintain 15 feet physical distancing. So it is spelled out specifically in this guidance regarding a soloist singer. I have had questions from some churches regarding whether or not they could have a family member if they're from the same household up there singing. But my response to that is it does say soloist singer, and that's a decision you'll have to make. But the guidance is pretty clear that it does say soloist singer.
Yeah.
Thank you for clarifying that, Darren. I missed that piece.
Yes, thank you both. I have a question from Pastor Janice Schofield. I heard King County is supplying surgical masks to congregations who request them. Does Whatcom County have those same resources? And maybe this is a good time to jump ahead just a little bit and come back to our experiences and talk about any resources that are available. Are there resources available for faith communities?
So this is Darren. So I'm not aware that the Whatcom Unified Command has a surplus of masks. I can check into that to see if they do. But as far as masks goes, we're at this time not supplying anybody with any masks, but I can definitely look in to see if there's a surplus that could be used to to deliver to the faith community. I know that the State Department of Health sent us some extra masks for the restaurants that we were able to get out to some of the restaurants. We may have some surplus of those. I'd have to check into that, but I'm happy to look into that for anybody. I have my email in the chat box. If you have more specific questions around that, I can.
Darren, thank you. And just so everybody knows, after this meeting, I will post a recording as well as notes from this with the information and the responses to your questions. It'll take me a day. We'll try to make sure we have this captured. A question from Barty. Are you mixing vaccinated and unvaccinated congregants in the same service? Is anyone doing this? And how is that working for you? Please feel free to jump in.
Well, yes, we definitely at Assumption have many vaccinated and many unvaccinated people. And at this point, like Father Moore said in his note to you, is we've always allowed families to sit together. And now by their own decision, some of the vaccinated people can be buddy families and sit together. But we just maintain the same protocols for safety in an overabundance of caution.
Kathy, is that something that congregants are coordinating on their own? Is their buddy families that they're going to attend with?
Yes, they are. In fact, I just secured my buddy family for Sunday.
Congratulations.
I'm so excited. Yeah.
Any other faith communities open and having experiences that they would like to share, positive things that are working for them, things that are not working, things that need help with?
One thing I want to mention, our task force has talked about whether we should have a vaccine passport, which is what we're talking about. And we decided that that's really not appropriate, and that people ought to make up their own minds about their risk. Obviously, the people who are vaccinated face less risk, but I guess I'm wondering how Assumption is handling that, and whether you're getting pushback from people if you're requiring evidence of full vaccination, and how that's working.
You know, Dr. Ban, we're not requiring proof of that. Again, it's being left in people's own discretion to do that. And again, we are still instituting the protocols that keep us as safe as possible. And we all realize there's no zero risk, but just honoring people's own decision-making in that regard.
Thank you. Doug Bonnell asked a question, where does one procure surgical masks? Has anyone been doing this and had good success with finding them and reasonably priced, probably?
This is Carol Chalukas. I just bought a box of them at Costco. They're the blue masks. It says surgical, and they're on sale this week.
Oh, good.
I don't know. I know $6 or $7 for 100 or something like that. I don't have it in front of me, but Costco is one option.
All right. Thank you. Faith communities rush to Costco. Pam Collier said that all of ours are vaccinated at this time unless visitors come. That's Hope Lutheran Linden. That makes things pretty simple. Okay.
Well,
and tomorrow, go ahead.
This is Ted Swinburne from Northside Community Church. We've been meeting in person since June, and we've been following protocols along the way. Praise the Lord, we've had no contact or problems with transmission of COVID during this time, but we find it important to follow the protocols. And as far as vaccinated or unvaccinated, we have not made any distinction between the two.
Okay. Thank you very much, Ted. Laura Welker dropped a link into the chat. It is an infographic handout from the CDC, which shows different kinds of activities, indoor and outdoor, vaccinated, and so forth. So that may help illustrate what we're talking about. I did want to honor time a little bit because I will keep this open at the end to continue this discussion, but I also want to make sure that our county and other employees can have the opportunity to share some tools for reopening, and this might preempt some questions. So Julie, Darren, and Elizabeth, what tools for reopening can we share with faith community leaders right now?
Well, this is Darren. I'm going to jump right in. So as far as, so again, my name is Darren Klein. I work with all the businesses, helping them reopen and helping them interpret the guidance. I know a lot of you have probably put your COVID plan together, and I'm available to review COVID plans and look at COVID plans and provide any type of recommendation, any type of suggestion that would help you folks out. It's not a requirement, and there's no requirement for a COVID plan to be stamped by the State Department of Health, Whatcom County. There's no regulation to do that. You just have to have it. And so I can answer any questions regarding the governor's guidance. So I'm a resource for that. I put my email in the chat box there, and feel free to email any time of the day, and I'll get back to you as soon as I possibly can, and try to help you out. If you have questions regarding illnesses and that type of thing, I can direct you and triage you to the right folks as well. So I have the connections to do that. So if you can't find those, just give me a call and I'll help you out the best I can. And I'll let Elizabeth talk about some of the materials.
Hi there. So we have a website, whatcomtogether.org, and it's a great place to go. And there's a few things you can find on there. One, you can navigate to the faith communities. So it has always the updated information, like what Julie shared earlier, the link to the governor's page. You can always go to faith, and everything should be updated on there, so you can find all the latest guidance easily. And then also the good thing on there is to sign up for materials. So as you reopen your churches, we have wonderful posters and decals. You don't need to be recreating all those things. And they're visible. They've seen them at other businesses around town, so it's something they're going to recognize. But they state, mask required, of course, and just, some basic language, but it's good for your decals, posters, all that stuff. And also, if there's anything if there's something you find that you need that we're not having on there, let us know. If there's a tool that you're needing as a signage or whatever, probably someone else needs it. So we could develop that as well for you. And I know we had at least the Hispanic congregation, we do have some of that signage available in Spanish as well. And so we've had that requested, so you have English and Spanish available on your doors. And then we also have a weekly newsletter that goes out, and you can sign up for that as well on our website. And it just gives you the latest tips and tricks. We have an employer's toolkit, for example, anything that we just want to make it so you're not recreating everything from scratch. Let's take all the best things. We get all the tips from Darren and his team, and we put it all together and try to do whatever we can to support you. So that's what we're here to do, is to just love on you. As much as you're loving on your congregations, we'll try to do what we can to support you as well. So.
Thank you very much, Elizabeth. That is really helpful. And I have been attending some of the communications meetings with Whatcom County Health Department, and they really are trying to help you get the message that you need to get out. So please do, rather than using your scarce resources, rely on folks who are doing this work, and they probably have these things developed. So thank you very much. Julie, did you have anything else to offer at this point in the presentation?
Just to trail on that, I'm just going to be dropping in some relevant links here for guidance. I just dropped in the wedding and funerals updated protocol, and I'm about to drop in the outdoor open air seating guidance with ventilation practice. And so basically that's the gist of it, is that we're here for you, and we will offer you all the guidance and resources that we possibly can to make this more safe and soon return to connectivity.
Okay, wonderful. Yes, we have great resources at our hand, at our fingertips here. Before we return to questions and discussion among faith communities and faith community leaders trying to answer these things. I did want to ask Whatcom Community Health Department to talk just a little bit about vaccines and the role of vaccination in resuming community connection. Before I turn it over, I did want to publicly here thank the faith community nurses and health ministers throughout the Health Ministries Network for connecting so many older adults with vaccination when Peace Health asked us if we could help out. Yay, Carol, good job, faith community nurses. So if you have those faith community nurses in your congregation, thank them. They're doing great work, and please lean on them and us as you have questions about all of this stuff. So with that, I just wanted to turn it back to the county to talk a little bit about vaccination. And Julie, Amy, Laura, did you want to talk about that a little bit?
Sure, Julie, I didn't know if you wanted to kick it off or.
Why don't you kick it off and I can supplement?
Okay. Okay, I think my main role here was to kind of give a state of the union of where vaccines are right now in Whatcom County. So at a pretty high level, I'll just quickly talk about vaccine allocations or supplies, and they are ever just so slowly increasing every week coming into our county, which is great. We have over 50 individual provider sites, vaccine providers throughout all of Whatcom County, and a nice range geographically. Some points we feel like we're celebrating them as we see the dials move up in our vaccination rates. So of the current people who are eligible, so that's 16 and over right now, 42% of our population has received at least one dose. And then for our prior population, so even those that are under 16, we have about a third that are fully vaccinated. So those are really great milestones for us. We're continuing to celebrate, like I said, as we see that uptick. Other efforts or things I'd highlight is that there's been a lot of great community partnerships in linking everything from individuals to groups of people to employers, helping employers get their staff set up and linked to appointments. And so just a lot of really great collaborations between vaccine providers and community partners in making that happen. And then there's just also another really great collaborative efforts in various pockets of our community in increasing access points. So while we still have 50 provider sites that are either a pharmacy or a medical clinic, we know that's not necessarily where people want or will go to receive a vaccine. So there's a lot of great community partnerships happening to create additional locations. Some examples of this would be we've had the National Guard come in into our Whatcom County a number of times and went around and vaccinated a lot of our senior housing high rises and apartment complexes. We're coordinating out with the East Whatcom Resource Center right now to host a clinic out there with a local provider in the beginning of May. And we're also working with that same actual vaccine provider to establish a mobile clinic, or I guess they call it a pop-up clinic downtown that will serve our unsheltered homeless population and our folks that are living in homeless shelters or supportive housing, transition housing. So that's just, there's been a lot of that going on, a lot of really great community work. And I think that's where we're looking to all of you as well as leaders in the faith community to see how other ways we can partner with all of you to increase access to, we know that there's a range of concern. People have concerns or they want their questions answered around vaccines or just have a hesitancy and they just want questions answered. So, and it's the trusted individuals and trusted leaders in their communities that they'll want to hear from. And we're looking to all of you to partner in those ways. So we want to make sure we're providing you with accurate, up-to-date information that support conversations you might be having with your congregations. I'll stop there. I'm gonna let Julie or Laura jump in, see what maybe I missed or didn't cover that we want to highlight here.
I think that the general stance, yeah, like you said, Amy, that we're coming from is to find out the barriers of where the hesitancy might lie for those that are reluctant to or ready to be vaccinated or feel that that's the right choice for them. And so to honor the sensitivity of it and to just have compassion around people's own choices and not to bring more division in our community, but we are here as resources for education and offering the history of the vaccination, and the works of it is pretty phenomenal to me. But basically the community vaccination center, the feedback that we got from our survey for the hours of service, we are operating on Tuesdays and Thursdays from 3:30 to 8:30 p.m. at BTC in Building G, and Saturdays from 9 to 5. And also just Saturdays from 9 to 5. And for anyone who's interested about the mRNA vaccination that's been in the works for 30 years, I think the feedback that our community and nation and maybe even globally hears is that this is a rushed vaccine when it's been in the works truly for 30 years. And it's a very different vaccine than the traditional vaccine. So if anyone wants to know more, I'm here to offer more education. And
thank you.
That's pretty much that.
Very good. So we have great resources for learning more about vaccinations, if that is something that you're interested in. And we want to make sure that you have the information that you need for that. Laura, did you have anything to add to that?
No, but I will respond to Carol Nicolay's question in the chat, which is about Johnson & Johnson vaccine. Carol, the supply of Johnson & Johnson is really limited right now. We expect to that to go up as the kind of the wheels sort of get turning around J&J again. But as far as where to go, it's not consistent. Some weeks it goes to some providers, some weeks it goes to other providers. So unfortunately, there's not a super clean, clear, consistent answer about where you can find J&J. I will say that on the state, Washington State Department of Health vaccine locator, they are now listing what type of vaccine each provider has, where Pfizer, Moderna, or Johnson & Johnson, or sometimes more than one of those. So that's probably the best resource for identifying what type of vaccine each provider has.
Thank you very much, Laura. I did want to mention that, let's see, it was just confirmed that the Bellingham Chamber of Commerce has some free masks still available. Email liz@bellingham.com. So that question is answered. Okay. We have a few more questions that have been popping into the chat, and so we want to make sure that we get to those. The first one was regarding exit procedures from services. How are people handling exiting the church? And the second question was on ventilation in facilities. And so if we want to answer both those, first of all, how are people handling exiting from services in an organized fashion?
Well, at Assumption, the hospitality ministers dismissed them row by row. We're getting a little less formal after a year, but that was the initiating conversation. And as for ventilation, we just open all the windows and have a door open.
Okay. Any other folks dealing with ventilation, upgrading ventilation, and does the county have any other guidance regarding ventilation or information on that?
I can speak.
Oh, go ahead.
Okay, I can speak on what's happening at United Church of Ferndale. The congregation we're not meeting in person yet because our one of our denominations is not allowing that yet, but we are preparing the building. So we've put in extra fans in the restrooms, and we've put MERV 13 filters in all of our furnaces. And then we're planning on having doors and windows open. So everything that we possibly can. And we have air filters or little machines in the offices so that there's extra in the offices. That's what I.
At Hope Lutheran, we have, we're exiting one row at a time from the back to the front. And so that's less people. And then we also got a fogger to clean everything in the church.
Very good. Any other questions regarding or responses regarding exit procedures or ventilation?
I am curious if there's a county person that we could talk with about ventilation and getting information.
Sure, you could talk to me, Pastor. You could send me an email. I put my email in the chat. Feel free to send me an email, and yeah, we can hook up and talk about it. Try to answer your questions on that for sure. Yeah.
Great, thank you.
Yep.
Any other questions from faith communities or something you would like to share about your challenges or things that you've done that are helping you to reopen successfully and safely?
I'm just curious how folks are doing as more and more people get vaccinated. It's becoming harder. I'm finding. I think the next couple months are going to be actually some of the harder months, and that's just been my experience as people get to know, or as it's just getting harder to encourage people to keep going with all the intense policy when probably 70–80% of the people coming are vaccinated, at least in our context. So I'm just wondering how people are holding up with that, and what kind of communication might be helpful. But I just know in a lot of contexts I'm talking, it's like this is gonna kind of the trickier in-between season where more and more people are vaccinated.
I don't have a lot of information about that, but I think those are real interesting questions about how you address that as the population. A significant portion of the faith community is vaccinated and not others. I know I go to Sacred Heart, and within Sacred Heart, we're just starting to solicit or resolicit people to serve as sacristans and extraordinary ministers of Holy Communion, etc. And I'm not sure if they're going to, we sent our note if you're interested, and then they're going to do some training and stuff on protocols, COVID protocols, but there was nothing about whether we were vaccinated or not. And I'm not sure if they're going to ask those questions, but when you start, it seems there's a difference between people that are part of the congregation and those people that are then providing a service role somewhere, whether that be ushers, et cetera, about vaccinations. I think it's a really rich topic, but I don't really have much information on it. I would say too that I wanted to say something about exiting, that initially when following, I believe, the guidelines over the last year, it's like when it came time to exit, it was very clear. You exit the church in one direction, released by pew, and then do not stay around and talk with people. You just moved out. And, there was very, very clear direction about that. But it seems that has the part about exactly which door you're exiting, and the part about people not sort of spending a few minutes outside talking to people. It's not as active as it normally would be in normal times, but there's certainly more people stopping and visiting with people they haven't seen in a while, or with people they visit with every week, whatever. So I don't know what that, I sense that would be true for many congregations, unless there's clear messages about how you exit, that's going to happen. People are going to leave and they're going to make that connection, because that's it. Sort of seems like that's an important part, an informal part of the service.
Mm-hmm. Thank you, Kevin. It sounds to me like that again, the issues that are going to be the most difficult are setting ourselves up for success regarding compassion. And some of that is establishing those guidelines very clearly up front so that there aren't questions. Whether, the procedures for entry and exit and sitting and how we do not gather after the service, or how we can gather, safely in different ways. And so I think that all of that troubleshooting is probably the most, is really critical. And then I think it might be helpful to continue the discussion regarding, how people are handling vaccination, and those who are vaccinated and those who are not. Obviously, this is a medical issue, and we don't want to judge or draw attention to or away from this and individuals. However, it is a real issue. So I wondered, are folks interested in continuing that conversation over the next few months, and how we're handling this as the CDC updates guidelines and we start to practice some of this? You're welcome to just put a thumbs up if you'd like to continue a conversation down the line, and we'll make sure that that happens. Okay, Steve, Carol, okay, Kevin, Chaz, wonderful. Yeah, I would like to do that as well. I think that, I appreciate that, there's a way to convey science in a compassionate way. Thank you, Celeste. Yes, continue the conversation. Okay.
I'd like to take this moment to say thank you to you and to your team, including Amy, because of this wonderful job that you are doing. My congregations are 99% vaccinated, all of them and their relatives. So before I got in touch with you guys, we were at 0 vaccinated. And during the last few weeks, thanks to the material and the facilities and the job that you have done, 90% of our different congregations in the state, in the county, are vaccinated. 90%. I don't want to say 100% because there may be somebody there, but all of them and the relatives are vaccinated. So thank you very much on behalf of the Spanish congregations.
Well, thank you for sharing that very much, Ivan. That is good to hear. We do want to celebrate our successes, all of us. It's extremely important right now. It's very easy to fall into the barriers and not to take a moment just to celebrate. I'd like to close this out, but I'm going to leave this open because I do want you to be able to continue talking. But I did want to bring closure because I see that we have folks who do need to go, and we want to respect time. So I'm going to go ahead and drop the resource slide, or maybe Allison, could you drop the resource slide into the chat box if we haven't gotten that already? And so you can have a list of resources. I'll send that with notes from this, but I wanted to close with what I have read and what stays with me in variations as a Jewish proverb, a quote from Oskar Schindler, and an excerpt from the Talmud. If you save one life, it is as if you have saved the entire world. And I want to thank you for saving the entire world. To all of you, please keep in touch and let us know how we can help. I'm going to hold the space for conversation after closing. And I just wish you shalom and many blessings and good health. Please feel free to stay on the line, feel free to keep in touch, and look for future discussions on all of these difficult issues that we'll be dealing with. Thank you.
Thanks very much, Sarah, for hosting. Wonderful.
Most welcome. I appreciate our health department being here today and so many others bringing their expertise.
Yeah, thank you so much, Sarah. It was very, very helpful.
Oh, good. Thank you very much, Kathy. I appreciate it. And I appreciate your willingness to share your experience over the past year.
Yeah, well, it was a very nice meeting. Thank you.
Thank you.
Bye, everyone.
Bye-bye. Thank you, Carol. Thank you all.
Thank you, Sarah.
You're most welcome. Thank you. Appreciate you all being here. Very good.
Thank you, Sarah. It was very well put together. I really appreciate it.
Well, thank you for being here, Pam, and thank you to Shirley as well. Thank you, Ken, for being here. Didn't get to share a whole lot today, but we appreciate you being here.
Yeah, thank you. I think it's going to be really important to keep the conversation going, particularly with the variants and the uptick in infections and hospitalizations that we're seeing in our area. So don't let down the guard and keep things up. Getting the vaccinations going is really important. But as the variants continue to push the barriers, it's going to be important that that everyone stay closely aligned with the things that they're already doing and make sure that they stay in line with the things that need to be done. So thanks for the conversation.
Yes, thank you very much, Ken. We appreciate what the guidance you're giving to folks at St. Paul's and being able to translate some of the science to people and convey the decisions that have to be made. As much as people don't always want to hear about it. Yeah. Did anyone else have any other questions or things that are remaining on their minds today? Okay. Well, I will talk with Allison in the future, probably not today, but in the future about meeting to talk about some of these ongoing concerns about remaining vigilant with our safety measures and at the same time being able to feel connected. And I think that we can do that. I think people are doing that. They've become very good at doing that. Even if they don't want to do it, they've become good at it when they want to do it. So thank you.
Sounds good. Thanks so much, Sarah.
All right. Thank you all so much. Thank you. Have a good day.